Welcome and thank you for being here. This session is an introduction to the Children's Long-Term Support Program, or CLTS. Before we get started, I just wanted to note that program changes do happen. The information being shared in this recording is current as of today, October 31st, 2024. My name is Danielle. I'm with Family Voices of Wisconsin, and I'm also mom to a young adult at home that was supported by the CLTS program for several years. You might hear me talk about him in some examples coming up. The intention of this presentation, my goal, is to pull back the curtain a bit so you can come away with an understanding of the CLTS program, how it's intended to work, and what families should expect as they begin with the program. Before we dive in, a little about us. Family Voices of Wisconsin is an affiliate of National Family Voices and serves as Wisconsin's HRSA-funded family-to-family health information center. We are also part of the statewide network serving children and youth with special health care needs, as supported by Wisconsin's Title V program. Our work is really focused in three central areas. One is developing easy to understand information for families through newsletters, fact sheets, and learning sessions, just like this one. Providing family leadership opportunities, including the Wisconsin Family Leadership Institute, and through our involvement in systems change and public policy initiatives. We are grateful to be part of the Title V network in Wisconsin, which connects our organization to all of these other agencies and programs. The benefit of these connections for families is that if we can't answer your question about something, there's probably someone in this network that can, and we lean on each other to support families. This learning session is based on family input as far as what they found unclear about the program or what they had the hardest time understanding or what aspects they wish they had known about earlier. The intended goal is that this information will help the program's newcomers have a good foundation of knowledge on how the program works and what it offers, so that the experience can be a smooth one for all involved. We'd like to thank the more than 100 Wisconsin families from multiple communities that shared their experiences with us, forming the basis of this presentation. I'd like to start by sharing some background of the program. The CLTS program is funded through a Medicaid waiver. And by waiver, I mean a waiving of Medicaid money into the community. The usual rules of Medicaid are waived and are made flexible to support families in other ways outside of a hospital or a clinic setting. It's important to note that the program that supports families this way varies from state to state. So everything we're sharing is specific to Wisconsin. It's also important to note that the funding for this program comes from a combination of state and federal funds. So the guidelines that are in place for the program, some of them might be federally mandated and some of them may come from the state. The intention of the program is to support kids at home and in their community instead of in an institution or a residential setting. Next, let's talk about what this program can do to support families. One of the greatest strengths of the CLTS program is that it is very flexible and it can support families in multiple environments, including at home, through things like home and vehicle modifications, sensory or safety equipment at home. It supports families in the community through supports like childcare, mentoring, and some transportation. At play through memberships or other recreational opportunities like swimming lessons. And CLTS can support the whole family through the provision of respite and conference registration, where families can learn more about their child's diagnosis. So, how do you know if your child is eligible? Here are the current eligibility standards for the program. The child must be younger than age 22, be eligible for Wisconsin Medicaid, live at home in foster care or in another approved setting, and they must need a level of care that most people would receive at a hospital, nursing home, or in a residential setting for people with developmental disabilities. And they must be able to get safe, required care at home or in the community. Here are some of the frequently asked questions from families. Does my child need to have a medical diagnosis to be eligible for the CLTS program? And actually, no, they do not, but it can be helpful with the process. If your child has a medical diagnosis, share that because, again, it is helpful. If they don't, that's okay. Sometimes those appointments for medical screenings can take weeks to months or even, well, frankly, it could be a year. With that in mind, one of the benefits of the CLTS program is their unique functional screening tool that they use, which does not require a medical diagnosis of anything. So, and I'll talk more about that in a moment. Second question, if my child isn't found eligible for the program, can we ask for another evaluation? Yes, you can. Our kids are growing and changing. And so know that even if you have an evaluation today and it's found that your child is not functionally eligible, we all recognize that that can change, whether it's 6 months to a year later. And so just know that that can be revisited if and when things should change. So let's talk a little about how this eligibility decision is made. In addition to the eligibility steps I mentioned earlier, of kids must be under age 22, medically eligible, etc., our kids are evaluated to see if they meet the standard of care that might make them eligible. And this process is called a functional screen. Here's what you can expect in this functional screening step. You can anticipate questions about their diagnosis or diagnoses, if there's more than one, if they have them, about their needs, about the child's abilities, and about any challenges in daily living that our kids might have. It's also good to know that the screener may ask to reach out for additional information through the school. So they might want to a release to talk with school staff or healthcare providers, including any therapists. But the standard is that within 45 days of when you contact your county waiver agency about the program, a functional screening visit should take place. A little about that functional screen. As a parent, I get it. We spend a lot of time focusing on the things that our kids can do well, right? And emphasizing their strengths, thinking of things from the perspective of my child's best day, myself included. However, screening time is when you really want to be candid. Some have said, picture them on their hardest day and use that as your frame of reference. Not only getting this screener right is important for eligibility for these programs, but if something were to happen to you, sometimes the screen results are used to determine the type of care that our kids might need if we aren't here to provide it. So sugarcoating their abilities at this step won't help someone new stepping into the picture. I also wanted to mention, I know how hard it can be to talk about the things that are hard for our kids in front of them, right? So just know that when you get to this step and you need to be candid, it's okay for your child to go play in another room with a friend or with a caregiver or a grandparent so that you can have that conversation one-on-one with the screener. Some of the feedback that we've gotten from families on this step include work hard to keep these initial appointments. Sometimes if you have a conflict and it needs to be rescheduled, that can set things back days to weeks or even more. So try to avoid rescheduling those initial appointments. Another family told us to be honest about how hard it can be. Accepting help is hard. Asking for help can be even harder. We understand that. The professionals you're talking with also understand that. But know that if you don't say it and you don't articulate it, they won't know and they can't record and document if you don't share. Keep in mind that once you're enrolled in the CLTS program, that functional screen will be repeated annually. A few examples when it comes to, again, the way that we should share about our kids at this screening step is keeping in mind the difference between a rosy perspective and a realistic perspective. One example might be, can your child shower independently? And I might think, well, can my child physically step up into the tub for a shower? Sure, but that's a rosy perspective. A realistic response might be, without me being there to wash their hair, face, and body, no soap would be used. Another question that you'll be asked might be, can they use the bathroom independently? A rosy response might be, can they walk in and use the bathroom? Sure, but a realistic perspective might be, but they can't take care of their own bottom. Rosy versus realistic. So let's say you've completed the functional screen process, but you disagree with the results. Disagreements can come up. If after that screen you disagree with the outcome, there are some things that you can do. The first is to ask the screener for an appointment to review the functional screen and discuss the results. We really encourage families at this step to have a curious mindset. And if something is found to be incorrect, the screener tool can be corrected and recalculated. In addition, you could appeal the results, but it's important to note that if you are going to file for an appeal, you'll need to start this process within 45 days of when you receive the notification of the results of the functional screen. Keep in mind, again, that you can reach out and ask about a rescreen at a future date if you feel that things for your child have changed. The person in the program that families are going to interact with the most is the Support and Service Coordinator, or SSC. So let's talk about them and what they do. So, who will I work with when my child is enrolled in the CLTS program? Well, it's all in the name. They are truly a support and service coordinator. It's important to note, too, that these individuals are not a caseworker or a social worker, but they are still a great source of resources and support. The support and service coordinators are employed by the county or the county waiver agency. And the role of the county, by the way, is to serve as administrator of the program, keeping in mind that some counties subcontract this work to a local organization, and another county might have county employees in this role. An important tip for families is to ask your coordinator about the other programs that might be of benefit to your family. The way that coordinators approach their work is using a philosophy of deciding together. The goal is for decisions to be made about things as a partnership together with families. Deciding together is a family-centered, collaborative decision-making structure. You'll work together to make comprehensive, outcome-based support plans based on your goals for your child and for your family. And this process recognizes and maximizes capacities, abilities, and builds resiliency in addition to promoting a self-determined life and inclusion. Like any relationship, communication is very important. Help the support and service coordinator understand how your family works. Be sure to talk about the best times for them to connect with you. Maybe you're more available in the morning than in the afternoon. Talk about the best ways to communicate. What's the easiest way to connect with you? Is it by email? Is it by text? Is it by a phone call? Do your best to keep the relationship positive. Consider sending photos of your child in the swimming lesson that your coordinator was able to help arrange for you, for example. If you disagree about something, do your best to ask clarifying questions, keeping that curious mindset to work your way through it towards a solution that works for everyone. Keep in mind, though, too, that while your coordinator is supporting your family and your child, they're also supporting in the same way many, many others. So do what you can to keep your emails and other messages concise and to the point. One support and service coordinator offered as a tip for families: if something comes up and it's urgent or it's a timely situation, be sure to say so right away in that email message or in that voicemail message or in that phone call. This is really important for them to know. And it's also good for families to know that there is an annual assessment using that functional screen that will take place. So that functional screen that you did at the beginning, you'll be repeating that annually. Communication is key, but as sometimes happens with the human condition, it can be imperfect. If that happens, here's a few things that we encourage families to keep in mind. The first is that staff changes sometimes happen. It's simply a reality. So the support and services coordinator you have today might be someone different tomorrow. While it does affect you, please keep in mind that this is not personal. It's not intended to be an obstacle. Simply do your best. Also, you can request a different coordinator if yours isn't a good fit. Some agencies might limit the circumstances for when a change is granted, but you can still ask. As far as how often you can expect to hear from your support and service coordinator, you should hear from them monthly. That might be by email or a text message to just check in. You should have some kind of a communication exchange at least every 3 months, where they may reach out to you and they're looking for some kind of a response. And that could be in a phone call or in an email. They do need to make in-person visits with the child every 6 months, with the child present, and at least one annual visit does need to be in the home with the child present. Another tip that we got from some families about their experiences in this program is they want to encourage other families to be friendly, but be cautious about becoming friends with your coordinator. Remember that this is a professional relationship. One of the most important pieces of paper your coordinator will use is the Individual Service Plan, or ISP. So let's talk about that for a moment. The ISP, the Individualized Support Plan, is a document where you and the coordinator work together to outline the goals you have for your child and the services and tools that you decide together that will support your child in reaching those goals. Anything that you request needs to support the goals on this document. There's no list of possible stuff to ask for that your coordinator will give you, and that's intentional. That's how they're able to keep things super flexible for every unique family. That's why it's really important to make sure the goals you outline are meaningful. Now, being asked about goals for our kids is a big question, right? If you'd like help with this, there's a new app for families called Creating Goals for Children. We also want to caution families about comparing the services that they receive with that of others, because I can tell you now, they will be different, and that's by design. No ISP is alike, even if the medical diagnoses are alike. Also, remember the goals you set today are just for today. Our kids change. Our goals for our kids change. And those goals are reviewed with the ISP at least every 6 months, and they can be reviewed more often if needed. So if you need a change, reach out and ask to talk about it. Our kids are growing and changing often, so they expect to hear from you. So what are some examples of the kinds of things families might receive under this program? Let's take a look. Here are just some examples of the kinds of things that may be covered under the CLTS program. It could include support services for the family, like respite care, or teaching and skills development, like daily living skills training. Management and coordination, like community integration services. Physical aids, like vehicle modifications. Housing related things like home modifications. It's important to point out that CLTS is not designed for services or items that are paid for by the Forward Health Card. That might include occupational therapy, speech and language therapy, applied behavioral analysis, physical therapy, and others. It's also important to recognize that CLTS is considered the payer of last resort, with one exception to that being through Indian Health Services. There is no complete list of items. Again, that's intentional and that's by design to give families the flexibility to identify what's going to serve them best in partnership with their support services coordinator. According to support service coordinators, here are some things that they may provide, but that many families don't know about or think about. Parent learning sessions to provide education on their child's diagnosis. That could be the form of a book, a workshop, or attending a conference. Grief services, health, wellness, and other memberships for the whole family, as well as community engagement, discovery and career planning. Here are some of the things that are within the scope of the program and some of the supports and services that tend to create the most confusion. The difference between respite care, child care, and personal care is a common area of confusion. Respite care is designed to give caregivers a break for relaxing or recreation, and that is something that CLTS can cover. Childcare to possibly cover the additional care costs to support the child in a childcare environment while parents are working or in school. That is something that may be covered by CLTS, but again, I need to stress here, they cover the additional care costs for children that are of traditional childcare age. That base cost of the child care is still expected to be covered by the family. Personal care is medically oriented and covers activities of daily living, including toileting needs, bathing, feeding, or eating. That is a service that is covered by the Medicaid card service or the forward card. And by the way, I should also note personal care coverage does require an additional assessment. Some of the items that are outside the scope of the program could include clothing, household appliances, or housing, such as rent or mortgage payments. If you need some support in those areas with those things, please do contact your support service coordinator to help you identify other local resources. It's also important to be sure that your ISP outcomes connect with the supports and services that you're requesting. It's also true that families in multiple programs sometimes get them mixed up. There's also a reality of the limitations of available providers for some services. So do your best to be open to creative solutions and work together with your coordinator to meet the need. Let's talk a little bit about what families can do to keep things going smoothly while their kids are in this program. Families are often the ones to find providers for their child's needs. This lets the families choose the provider that's going to be the best fit for them. Please know that it's not meant to shift responsibility onto families. It really is so that families can identify the best fit provider for them. If you're having trouble finding a provider for a needed service, certainly reach out to your coordinator and see if they're willing to share the providers that other families are using. Also know that you can bring anyone you like into the planning process, whether it is that functional screening step or other changes that might need to be made. Invite anyone you like into that process. It's also good to know that meetings can be held anywhere that it's convenient, with one exception, that one annual meeting must be in the child's home. But otherwise, if you'd like to have every other meeting be during playtime at the library, go ahead and do that. That's okay. Also, you have the right to an interpreter. And that interpreter or translator can be in any language, including American Sign Language, and you can also use any other communication aids. You can meet with your coordinator as often as you need to. Again, They're there to coordinate and to work side by side with families. So if you need something, reach out and ask to meet. It's also good to know that you can move anywhere within the state of Wisconsin without a disruption to services. You certainly let your home coordinator know about your plans to move, the county that you're planning to move to, so that they can begin that transfer process. Some families, depending on your income level, might need to contribute each month towards the cost of the services and supports that your child receives. And this is referred to as a parent payment portion. How much that payment might be depends on your family size, your family income, and how much the services in the ISP cost. You will not have a parent payment portion if you are part of supplemental security income related Medicaid, Badger Care Plus, Food Share, in a W-2 program, or utilizing WIC, Women, Infants, and Children. Sometimes, once you learn your child is eligible for the program, there can be a delay in accessing those supports. So here are some things you can do if this is the case for you. All families should receive an enrollment letter once your eligibility for the program is determined. That letter includes some really important information. It includes the timeline for anticipated enrollment. And by enrollment, I'm referring to when you can start actively utilizing the program. It'll also tell you who to contact in the meantime with any questions. It'll also should provide some information on other programs you might be eligible for that can provide support in the meantime while you're waiting for enrollment. Keep this letter. I mentioned earlier about starting an accordion file. Keep it by wherever you open your mail and start tucking anything that comes in the mail that's relating to the program into that file because you may want it to refer to later. This letter is one of those pieces. In addition to CLTS, there's two other programs that can complement the CLTS program. One of them is the Children's Community Options Program, also referred to as CCOP, and Comprehensive Community Services or CCS programs. Inquire about your eligibility for these programs with the staff member that you had your evaluation with. Another really important place that can be a source of terrific information, especially during this temporary waiting time, are the Children's Resource Centers. The entire state of Wisconsin is split into 5 regions, and each region has its own Children's Resource Center. The best way to find your local center is through Wisconsin Wayfinder, and the website address is shared here for you. At those centers, they can provide localized information and resources for you, which might include things like a lending closet for borrowing temporarily equipment that might be supportive to your child at home. They are also good ones to have local information on local philanthropic groups that can provide small grants for small things. They could also provide information on respite programs that can provide support to your family in the meantime. Sometimes things can change or big and important things can come up while you're waiting to access resources. And if this happens, here are some of the things that you can do. You can contact the support service coordinator that is listed in your enrollment letter. And again, when you start that email or that voice message, be sure to indicate that it's important. Some additional resources might be your Children's Resource Center. There's one in that covers every portion of the state. Your child's primary care provider or their school social worker. You could also reach out to your child's therapists, your local community center, your community health clinics. Even if your child is not a patient, you can still reach out to them. Of course, there is your house of faith, and you can also reach out to peer parents who you know have had similar experiences. Here are a few more helpful tips some families have shared with us. Starting on day one, keep all printed materials. Important information, including who to contact, any anticipated enrollment delays, all of those things will be coming by mail. So again, start that accordion folder somewhere and just start putting paper into it. Also keep in mind that the timeline for decisions generally on support requests when you are in the program and you send an email to request an item or a service, it can be about 2 weeks for your coordinator to respond. It's also good to know that for high dollar items, purchases over $2,000, that there's a process involved with that. Usually when this is the case, we're talking about things like home modifications, maybe technology or vehicle modifications. When that's the case, again, the first step is going to be your coordinator to let them know what the problem is that you're looking to solve. You're thinking about possible solutions, and keep in mind that usually 2 quotes or 2 bids are going to be needed. And to go this route will require a prior authorization from both the county and the state. So allow time for that. It's also important to know that some circumstances might require a letter of medical need from a physician or a letter of support from a therapist. If you're asked for this, do your best to facilitate that taking place. Again, we want to encourage families to avoid comparing your covered items with other families. Remember that the items and the services and supports that you receive as part of this program are outcome focused and super individualized. Rarely are 2 ISPs alike, which means that rarely the services and supports that you receive will be alike. Some ideas for when you can't find providers could be existing parent networks or the Children's Resource Centers through Wisconsin Wayfinder. Sometimes, despite our best efforts, things don't go according to plan. If that happens, here are some things that you can do. The first thing we really recommend with families is to try working through the difference with the support and services coordinator working with your family or with their supervisor. When you're having these conversations, we really want to encourage you to have a curious mindset, seek to understand or to ask questions. It's also important to focus on the problem that is trying to be solved and less on what we might think the ideal thing is to solve the problem. Everyone is best served by being open to being creative and, again, deciding together. If needed, keep in mind there is an appeal process that exists, and I'll share more about that in a moment. And if all of those things fail, there is the state DHS Bureau of Children's Services Technical Assistance Center. Here's their telephone number and an email address that you can contact. Again, there is a formal appeals process connected to this program. So here's a little about that and what's important to know. There is a set time window for appeals. Once that time goes by, the opportunity to appeal is past and is no longer possible. Each type of decision has a different time frame for an appeal, depending on the decision that was made. It's important to note that you can file an appeal while you're also working on other remedies through the county. The current functional eligibility determination appeal timeline ends after 45 days. Decisions about specific supports or services that have been requested is 90 days. And by the way, a verbal denial is still a denial. So if you ask for chicken soup and your coordinator responds, no, we don't, that's not something that's within the scope of the program, we don't cover that, note that on your calendar because that is still a denial and that same timeline begins. Decisions about financial recertification, again, that also has an appeal window of 90 days. There are two different appeal process options that you can take. One is to complete your county's grievance process. The other is to file for a fair hearing by the Department of Administration Hearings and Appeals. It is important to note that, again, those appeal timelines continue while you're having conversations with your support service coordinator, with their supervisor. So if you're having those conversations, keep in mind that 45 days, 90 days is still the time window, even while those conversations are going on. You can always cancel your appeal request at a future time if you like. If you are feeling unsure about a decision, here are some things to think about. One is it's natural for people to have differences of opinion from time to time. It's part of the human condition. During the appeal, the services may continue. However, if the finding is not for services to continue, the county can seek to recover any money that they've spent in the meantime. So have that in mind if you decide to file an appeal and ask the county to continue providing services. There are ways to address a decision that you don't understand or don't agree with. You can ask questions when a decision about something is unclear. You can continue to talk with the coordinator or even reach out to the support service coordinator's supervisor. You can complete your county's grievance process, and you can file an appeal through the Department of Administration's hearings and appeals process. Just make sure if you take on multiple of these, keep those timelines in mind. And finally, how can families get started with this process? This DHS website is a great place to start. Keep in mind that the county waiver agency staff should contact you within 10 days to put something on the calendar for a future time to schedule that initial home visit. And you should hear back the determination within 45 days after that home visit. And this concludes this presentation. I hope this has been helpful. To learn more about any of the topics we've covered, please see the Get Ready resource guide on our website. Thank you.